The other name of the stroke is called as CVA, right? CVA, it ascends to any right side or the left side weakness. Why this weakness happens? The people is usually complains of weakness and other clinical features like deviation of the mouth or the weakness of the arms, any left or right arms, not able to lift the left leg or right leg. It happens often. Right, we are having the slurring of the speech. In the what happens sometimes with the people with the comorbidities like hypertension, if they're not taking proper medication the same proper time, the hypertension is like the BP is not controlled. Like uncontrolled BP can lead to sometimes intracranial hemorrhage, subdural hemorrhage, all those things. Okay. Sometimes due to the RTA, I mean, due to road traffic accident or anything like that, sometimes the patients, often we see patients coming with the SD, subarachnoid hemorrhage, subdural hematoma, all those things. So what happened whenever, I just want to address, but I want to make people know about the things like whenever any one of your relative or family member is having some complaints like slurring of the speech or the mouth deviation or the weakness of the limbs, weakness of the hands or legs, or not able to grip the things, not losing the grasp, that is very important, right? Along with the forgetfulness, altered mental status, the patient sometimes happen. The patient is not oriented to time, place, and persons. He or she is not able to remember the things, forgetfulness. All those things, whenever it happens, they should not be ignored. Immediately, you should consult your family physician. That is very important. What happens when there is a stroke? When there is a stroke, there is just a clot in the blood vessel, or sometimes there's a hemorrhage. It happens in the brain. We have the like in the CT, when we see the CT scan brain, when the patient comes in emergency, we can see that there's a midline, we can say midline of the brain, right? What happens? Sometimes the hemorrhage is so big that it pushes the midline. In that case, the patient becomes very drowsy. The patient becomes very drowsy. Sometimes the people also not reacting. People become dilated and all those things. Along with that, when this type of hemorrhage or this type of stroke, there are two types of stroke we should aware about. One is ischemic stroke and another is hemorrhagic stroke. Ischemic stroke, the patient generally have less complaints. Patient remain oriented, time, place, and persons. Generally, they have problem, difficulty in speaking. Sometimes whenever they're taking the food, maybe the drooping of saliva, the drooping of the food, these things happen. But when there's a hemorrhagic shock, that is very significant and it affects patients' sensorium also. Most of the common is ICH, intracranial hemorrhage. So when this intracranial hemorrhage, subdural hemorrhage, these things happen. Sometime in the right basal ganglia bleed. Nowadays, we are getting a lot of cases with the right basal ganglia bleed. They are also not necessarily that patient will have the altered mental status, but they will have like they are conscious but not able to remember the things. Maybe when he is eating or when he or she is eating. Maybe she has taken his or her food just half an hour back. Then she's telling, "Did I have my food?" Like this type of sort of examples, to be precise, happen generally. Okay, so these things are very important. Whenever there is a patient coming to the emergency, we ask about when the symptoms are onset. Since when you are having these symptoms, what the duration of the symptoms, right? Why it is? Because then we have also the treatment option along with the blood thinners, antiplatelets, all those things, ecospirin, all those names we are acquired of, like ecospirin, clopidogrel. These are the medications we all generally take. And so why it is important to know the duration? Because when the duration is important, because when the patient comes with this type of complaints, we have to think about the time of the management for thrombolysis also. Whether we can do thrombolize the patient. Why thrombolysis is important? Thrombolysis is important because then the blood clot happens and within 3 hours, if we can do the thrombolyze with some of the things, some of the medications are there, It's available in the market. Often under the medical supervision, those medications should be administered IV. The time duration would be 15 minutes, 10 minutes, half an hour, like that. Those medications will be effective, right? So whenever a family member anyone's family member is getting these symptoms, is very important when a doctor will ask you, since when you are having, when the patient is having this, especially uncontrolled hypertension, or sometimes the patient is having any ischemic heart disease, like any cardiac problems or anything sort of like that. So we start the patient on the antiplatelets or blood thinners, like that, right? That time one has to be aware of whether the patient is having blood thinners, whether the patient is having any headache associated with that, any bleeding or anything like that. Those things are very important, because unknowingly sometimes when the patient is having intracranial hemorrhage, maybe it's small, it's a very small intracranial hemorrhage, but when unknowingly, if the patient is taking a blood thinner, he doesn't know, he is not aware of it, and he is taking the blood thinners. And sometimes we can the patient is take heparin, like that, low molecular heparin or fragment, etc., like that. Heparin group of medications. That hemorrhage may develop into a large one. It can develop. It can diminish, or it hampers the patient sensorium level also, and there the fatality rate is also very high, right? So I must say that patient with the hypertension and the ischemic heart disease, those patients are suffering. They should have the 2 to 3 things in the mind. So first, they should take the hypertensive medications at the proper time. That is very important. And once or twice in 2 or 3 months, suppose if you are taking any antiplatelets or heparin, or you are taking subcut heparins, anything like that, you should consult your physician, because you need a routine checkup for that, whether because you need to change the medication or you need to stop the medication. That is very important for that thing. And one more thing, I should say, when hemorrhagic strokes happen, sometimes the patient can have at the same time convulsion, that we call as seizures. Like patient will have the epileptic seizures and epileptic attacks and like that, with the twitching of the limbs, to a twitching of the arms and all those things. So those things have to be keep in mind. Whenever you are getting like that, because any patient is having this epileptic, you don't know whether this is only epilepsy or is associated with the intracranial hemorrhage also. So I should tell the family members, whenever you are getting this type of things in the family, always take the patient on the left lateral position, always left lateral. And the patient should be like, if the patient is sleeping like this, the patient is having this convulsion, you should turn the patient to the left side. Why? One thing is that that is the best position in the case of epileptic disorder. Number one. Number two, it will help you to prevent the asphyxia also. This is very important. And one more thing I want to tell about the patient with the diabetic, right? With the diabetic also, one should be aware of the hypoglycemic attacks. Sometimes the hypoglycemic attacks also, it can lead to stroke. One should be aware of also about his sugar level, his or her sugar level, because people with the diabetic, hypertension, and ISD, ischemic heart disease, along with the patient with the blood thinners, they are at high risk, very, very high risk of developing stroke. We saw there are 3 new cases. The elderly male, 2 elderly male and 1 elderly female, they age only about 32 to 36 years old. They are not diabetic, but they have a little bit of history of hypertension, but which they used to ignore. They didn't take proper medications. They never used to take the proper medication at the time. So what happened is it leads to uncontrolled hypertension. Along with that, sedentary lifestyle. Nowadays we have so much work stress and some sort of addictions, smoking, alcohol abuse, and all those things. So this type of factors are more leading to stroke as well as elderly as well as in young individuals ranging from 30 to 40 nowadays. Prevention of the stroke is important. Number one, if the patient is hypertensive, the patient should be aware of, or the family relative should be aware of whether the patient is taking proper medication for the and hypertension or not. Number one. Number two, if the patient is diabetic, one have to check the sugar level twice, 2 to 3 times a day. That is very especially for the elderly male or female above 60 years of age, because they are more prone to hypoglycemic attacks. Number three, as I told, it's people more than 45 or 50 years of age. What happened? They are like some females. They have this premenstrual syndrome. Like they used to have the hot flashes. And nowadays, the most common with the female is PCOD, polycystic ovarian disease. That's very important, very common, isn't it? So they used to take the hormonal therapy and all those things. Those OCP, the oral contraceptive pills, for use for the long term, can give to some cardiovascular complications. Cardiovascular complications, along with that, they can have some other neurological complications, as I told, for hot flushes and all those things. They may develop hypertension, as I told, again interlinked. So hypertension, PCOD, hyperlipidemia, uncontrolled, all those things can lead to stroke. So what happened? I should suggest it can be prevented. Maybe it cannot prevent 100%, of course, but it can be prevented. At least we can try, give a little try, about 50%, isn't it? With proper medications, means avoiding a sedentary lifestyle, to quit smoking, to stop alcohol abuse. Those things may have, can have the add-on efforts. At least, maybe we cannot eradicate or eliminate the stroke, but at least we can minimize the chances of stroke or the risk of having stroke.